my name is Kylie Christensen. I'm going to be doing this skill of inserting an NG tube on the patient. I'm going to go over all the supplies I have first. So I have the emesis basin, tape, lubricating jelly, specimen cup, pH strips, my 60 milliliter syringe. My pen light actually broke at clinicals last week, so I have a mini flashlight I'm using in replacement until my new one comes. Gloves. This is my basin with warm water. I have my tubing, and this is 18 FR 14-inch NG tubing, and my towel, and of course my patient. I also have a cup with a straw for the patient to sip if they need. Alrighty. First thing I'm going to do is I am going to verify the orders before I provide the care to the patient. Once I verified the orders, I'm going to go ahead and gather my supplies that I have, and I'm going to head to the patient's room. Hi, my name is Kylie. I'm going to be your nurse today. I'm going to close the curtain behind me, perform hand hygiene. I'm going to go ahead and verify your name and date of birth, 2 patient identifiers before I get started. Awesome, thank you. So I am here to insert a nasogastric tube, so that's an NG tube for short. What that's going to do is it's going to go in your nose and down into your stomach, and we're just going to pump out the contents in your stomach through low to continuous suction to increase the healing in your bowels and in your stomach. Just something the doctor ordered to promote some healing. Do you have any questions about that? Awesome. So once I've gone over the procedure with the patients, I'm going to go ahead and get my supply set up. So I'm going to place the towel, or I'm going to put my gloves on first. I'm going to place the towel across the patient. I'm going to open my tubing, and I'm going to place it in the warm water. The purpose of the warm water is so that it softens the tubing and makes it a little bit more malleable as we put it into the patient. Once I have done that, I'm going to inspect the patient's nares. Okay, so I'm going to go ahead and look up in your nose. What I'm looking for here is making sure that there's no deformities or abnormalities that would be blocking being able to insert the NG tube in there. I also want to check and make sure the membranes in there don't look too irritated and that they can't withstand that. Once I verified that both could be a good fit, the next thing I'm going to do, I'm going to ask the patient to cover one side of his nostrils and just breathe. Good. Go ahead and cover the other one. Good. Alrighty, so I'm going to go ahead and insert the NG tube through your left nair if you don't have any objections with that. Perfect. So now that I've verified that I'm going to be inserting the tube through the left side, I'm going to grab my tubing and I'm going to measure. So I'm going to set this here. So I'm going to measure from the ear to the nose and then down to the xiphoid process. And in this case, it's going to be about 50 centimeters that I'm going to need to insert. I'm going to mark that off with a piece of tape. Once I've marked that off with a piece of tape, I'm going to go ahead and lubricate this. So take my lubricant. Stick the lubrication in there. Alrighty, so when I insert this, I'm going to have you look up. When you feel the tubing reach the back of your throat, you're going to bring your chin to your chest, and you're going to take sips of water and swallow. If you start to gag, I'll pause for a second, let that pass, and then we're going to continue moving it down. Questions? Okay, so on the initial insertion, I want to make sure that there's no resistance from his inside of his nair. If there is, I would remove it and then I would move to the other side. So first thing I'm gonna do, once it reaches the oropharynx, you can go ahead and put your chin to your chest, take some sips of water. Again, if you begin to gag, I will pause. So I'm gonna slowly keep advancing it. Good, keep taking sips of water, keep your chin to your chest until I reach that 50 centimeter mark. Once I reach there, I'm gonna go ahead and pause for a second. I'm gonna verify that it's in the correct placement. So what I'm gonna do is I'm gonna take my syringe. I'm going to withdraw. Going to withdraw. $10 milliliters. And I'm going to put that into the specimen cup. And I'm going to test it with a pH strip, making sure that it shows between a 1 and 5. And that's going to confirm that it is in his stomach. If I have any indication that it might not be in his stomach, I'm going to remove it and I'm going to completely start again. So the pH came back, it is in the correct placement. The pH is between 1 and 5. So I'm going to go ahead and secure this NG tube. I'm going to start by taping over the bridge of his nose. I'm going to go ahead and loop under. And around, securing it here so it doesn't move. After I've done that, I'm gonna make sure that he's comfortable, and then I'm gonna have him sent to x-ray. Before I leave the room, I would make sure the bed is lowered and that he was in a safe and comfortable position. Once the orders would be verified, I would then clamp this to his gown with the safety clamp. I would make sure that there's no kinks or anything in the rope. Connect this to the suction so that it would empty the contents in the stomach. I would make sure I would watch what's coming out of the stomach, document the characteristics, what it looks like, how a patient is feeling. Once I have done that, I would gather all my unnecessary supplies. So they disconnected the suction. I would dispose of all of that. Remove my gloves. I would go perform hand hygiene. I would close the curtain and go document the care that I provided to the patient, the assessment I performed, and the response that the patient gave me during the procedure.